Hello and welcome. This is Martin Kaufmann. I'm here to talk with you today about the TLC product line that we have available. And this product line is a culmination of two entities coming together to work on an innovative solution for casting, splinting, and padded bandages. OrthoPets and Dassiet have merged together and brought their backgrounds respectively in the expertise of human fracture, casting, splinting management, and you'll see that a whole material list in just a second, and OrthoPets, that brings all of the three-dimensional modeling and limb shaping, and most importantly for what we're talking about here today is the way that force application is applied to the limb. So what you're going to see today is an overview of the entire TLC product line. And when we say that, what we're really saying is your patient, your pet, needs a little TLC, that tender loving care, that total limb cast system that allows you as the veterinarian to very quickly and efficiently apply the level of support that you need, regardless of what the patient presents to you on that appointment. So let me start with what you see back here. These are the full limb examples. So this is a pelvic limb, total limb cast, and this system here comprises two shells. And the intent here is to provide you right out of the package with everything that you need to completely immobilize from the paw all the way up to the proximal femur. These have been designed so there isn't a left or a right, so all you'll need to decide is which leg are you going to be applying this to, and you'll make a small modification, and we'll go over that here shortly. The other part is the front clamshell. So when you're making a total limb cast, that term cast implies that you had some kind of a three-dimensional or circumferential fit around the limb. And one of the big things that we're solving for in the pelvic limb TLC is how to deal with the stifle and the proximal femur in a way that gives you more mechanical advantage to do the job with your coaptation that you are saying that you're doing. So we'll discuss that here next. Before we get into this really cool Unitex fabric, let's talk about how this proximal section of the TLC pelvic limb functions for you. So when you look at this model here, you'll see the paw segment that holds the patient in a more physiological normal alignment. Tibial-talus joint is in that neutral standing position. Stifle, the same, a neutral position. But you'll notice here along the caudal aspect, the two uprights that are potentially medial or lateral, depending on left or right leg, it doesn't close around the caudal aspect. That's open back here. And you also notice as you run parallel to the tibia and fibula and you get to the stifle joint, which would be approximating at this elevation, there's a swoop that goes caudal relative to where the femur would be. And what we've done is we've allowed you to gain access to as high onto the femur as you can with a cast, but leaving the flank, the rectus femoris, that cranial portion of the femur available for the soft wrap materials to hold the limb together into this upper system. And it also allows for the adjustment for the medial lateral width of muscle bellies. We all know that at the initial presentation, there tends to be a lot more muscle mass than at the end of your 6, potentially 8+ weeks of immobilization. So inherently, just within the design of this system, it allows you to always be perfectly fit to the limb segment medial to lateral because there's inherent flexibility. And because this doesn't connect caudally, that allows you to make that flexible change. When you're fitting this to a potentially a left leg, for instance, along that medial side of the groin, there's certainly an elevation that you'll run into and you just can't go any higher. So with a simple set of tools, a heat gun, this is just a standard heat gun from any hardware store, and your bandage scissors that you already have in your clinic. That's all you'll need. We recommend the cool spray to make that job a lot faster for you as you heat, trim, and with your hands mold and smooth out. But rather than waiting the 3 to 4 minutes for it to air cool, you can accelerate that in about 4 seconds with the cool spray. So just a handy tool to consider having. But it's just that simple. You take this, do your first fit check, modify the groin height so that it fits that patient as perfect as you can make it, and then you're able to close it in. Now, this whole system here is a simple pre-shaped system that allows you to gain one simple measurement to determine which one of the 6 sizes would fit your patient the best. So we're already providing you with a rigid exterior bivalve cast system it's novel in its design, it's easy for you to use, and it's already pre-shaped, and it's certainly very easy to modify. But then we took it one step further, and that's the underpadding. The underpadding is a proprietary fabric-based material that replaces all of your underpadding, all of the cotton, the compressive cling, your tape stirrups, and your vet wrap. So this is a breathable, it can get wet, it doesn't compress when it is in moisture, and this is all of your underpadding that you need. So then the usual question is, how thick do we make the underpadding? Well, and that's really just up to you, because we're not stuck with the constraints of thick cotton padding when it gets wet, or over a period of 4 days, 5 days, it'll compress down and lose the volume, which meant inside your rigid cast, you now have motion that you didn't intend to have. With this, you can go as thin as you want, or you can go as thick as you want. And that is no longer a barrier for you in how you use the underpadding. So with the Unitex fabric, whatever thickness that you deem most appropriate for your patient is the perfect thickness. What you apply to the patient on day 1 is the same thickness and padding that you'll have when you visualize that on your bandage check in 7 to 10 days. You can check it more often if you want, because the Unitex is simply machine washable. Just let it air dry, and you can reuse this. So your client may end up having a few rolls of this to exchange with you as they come in for their bandage checks. So the pelvic limb TLC is a way to choose how much of the limb you need to immobilize. If you didn't need to immobilize above stifle, but you were immobilizing and needed a cast from stifle joint distally, you could simply use your heat gun. You could heat right across the uprights at the level of the stifle. Using your bandage scissors, you can simply just cut that right off. Using your fingers, all you'll need to do is just smooth and roll the edge. It's just like working with Play-Doh. It's really just that fun and simple. And then again, if you want to cool it faster, use the cold spray. Otherwise, just let it cool by the air. Go to the cool water in your sink, anything like that. So the TLC pelvic limb is a way to stabilize and immobilize as much as you want of the pelvic limb in a way that you haven't been able to with your common cast. And that's really the fundamental innovation that we're bringing here for you to be able to take advantage of, is how we're able to give you a pre-shaped full limb immobilization system that takes away the barriers that you've had with your common cast materials. So another way to look at this is, if you didn't have to deal with the barriers of all of the cotton underpadding, the non-breathability of your elastic vet wrap, the tape stirrups that cause irritation, the limitations on how far you can circumferentially wrap above the stifle, if you didn't have that and you just had the strength characteristics of fiberglass, well then that's what you'd have here. So this takes away all of those barriers. So the thoracic limb TLC system works much the same as the pelvic limb that we just discussed. There is a caudal piece that begins right at the olecranon and continues down underneath the paw. The cranial shell presents itself along the cranial aspect of the humerus, just above the condyles of the humerus. So the elbow joint approximates right here, and medial and lateral we're grabbing along the sides of the humerus, but cranial we're reaching up much higher than that cast that is circumferentially wrapped could ever be. Typically, the medial side of the axillary, mid-humerus on some patients, distal humerus on some of those other patients, is your barrier for height. So when we talk about mechanical advantage, when the cast is required to immobilize the elbow or stabilize the humerus, The common cast ends just a few centimeters above the elbow joint, solely because you are creating a challenge for yourself. You have a barrier with your circumferentially wrapped materials. It's hard to get higher than the medial aspect of the humerus. Here we're presenting it way up to the top of the humerus just because of the design. So it's that simple clamshell that we saw in the pelvic limb TLC. So you have your caudal carpus piece, the cranial shell, and here again, if you decided that you only needed to immobilize from the elbow joint distally, you could again just heat right across the elevation of the proximal radius, cut it with your scissors, roll the top edge, cool it down, water, cool spray, air cool, and then you'd have your lower limb full cast. So it's just that simple. For a total limb cast system, you have your under padding, which is the Unitex fabric. You add the thickness that you want. You don't have the constraints of the cotton padding not being able to get wet, compressing if it does, or the adequate thickness that you wanted with cotton ended up compressing out over time. So the most important thing to describe here on the total limb cast system is that we end up having the ability to preform the shape for you, but then if you find something on your initial fitting rather than the initial creation of your cast, which is a very important distinction, when you do your initial fitting of your cast for your patient, you'll be able to run your fingers right down the medial and the lateral side of your cast now, and you'll be able to feel for bony prominences. One of the key benefits that we should be really concerned about is that you're no longer going to have to be reactive in a week when the patient comes back for their first cast change. Rather, you're going to be proactive on the initial fitting day when you apply this to your patient who just walked in with some trauma or some pathology, some injury. You'll be able to apply your Unitex fabric, place the patient in, palpate the fit. And because the wood cast material from Dassiet is so easy to use and so quick to adjust, modify and adjust, you can just simply use your heat gun, heat an area that you want to relieve for pressure. In that case, you would simply heat the area that you want to move away from a bony prominence. Perhaps there's an implant that you're trying to relieve contact from, a surgical scar that you didn't want to touch. Whatever the reason is, you can heat that area and just simply move it away. Cool water, cool spray, whatever technique you're using. Conversely, if you wanted to make it more intimate, you can heat a whole section of this with the patient placed in with their Unitex fabric on, and you can just hold this tighter to them, more intimate. So if you're talking about fracture stabilization and you needed micromotion control, then you just simply bring this a little tighter to the patient. So it allows you to be proactive and make the cast fit the way that you want it to fit, rather than discovering the challenges and the unexpected pressure sores that occur even in the first couple of weeks. And that's the same story here for that pelvic limb TLC. You can make your modifications on that initial fitting day, relieving malleoli or perhaps caudal calcaneus, the thoracic limb, those usual stories of radial and ulnar styloids, metacarpal heads, the sides of the digits, the accessory carpal bone, maybe there's a really prominent radial head. Whatever those areas are, you just simply make this fit the patient, and it's fast and easy for you to do that. So again, what you're seeing here is a way that you can rapidly cast a patient without all the barriers of your materials, preventing you from doing the thing that you wanted to do in the first place. And that was make a very protective, a very safe cast for your patient. Now, if you have a patient where you don't need the full limb cast or you don't need a circumferential cast presented to the patient, then we have the TLC carpus and the TLC tarsus. So the main difference here is that the TLC carpus is a splint. So when you think about your half splints or your spoon splints or that bivalve cast and you cut the front off of it and you're no longer using that cranial shell and you've got the caudal shell, right? You have that just portion of the limb in some stability. That's what the TLC carpus is. So as you think about splinting a patient, then it's the same process. You have your Unitex fabric to to apply to the patient for their padding, and then in they go. And then once you've fit the patient and you've adjusted your shell to fit that patient perfectly, then you just continue with your Unitex fabric. And this is what will circumferentially wrap the patient and the TLC carpus together. And the same is true when we're bandaging and we're holding all of the TLC products together, and you'll do the same here with the tarsus. So the Unitex fabric is now, as you're seeing, an intrinsic part of your system, where it is your under padding, but because it's not elastic, we don't have those same constraints or problems about making it too tight when you're making that under pad layer for the tourniquet effect, or here when you're using it instead of the tape to hold the splint to the patient. It's all one thing. So you'll have your extra rolls in your kit, and it allows you to quickly pad the patient with your under padding, fit your TLC carpus or TLC tarsus, make those adjustments with your heat gun, cool it down, and then you either continue wrapping the remnants that are already on the leg, or you grab your next roll, and now you're just connecting the patient and the splint together. So on the tarsus TLC, you'll have that malleoli pressure point that you'll be looking for, the metatarsal bases, the metatarsal heads, second and fifth digits. You can also get really curious about the proximal aspect, perhaps the tibia, fibular head, the popliteal area, as you look at stifle flexion. So the caudal calcaneus is always that usual suspect. That can be heated and moved away. Just as you see fit for your patient, it's just quick and easy to adjust. So quite simply stated, the time it would take you to open the fiberglass pouch, submerge it in water, squeeze the water and saturate the water all the way to those inner layers of fabric in the fiberglass, and then begin your circumferential wrapping, you're already done adjusting your wood cast. It's just that fast. It takes a few seconds to heat up with the heat gun and a few seconds to cool, and you're done. You already have tread applied to the bottom, so you have durability and you have grip. So we don't have to see our patients sliding with their little casts or splints on. Now, as you've noticed, we've been talking a lot about the utility of the Unitex fabric. So the Unitex fabric has served so many functions. It was all of your under padding, it replaced your tape stirrups, it replaced your cotton, the cling wrap for the cotton, and the vet wrap, because it's self-cohesive and it's not elastic. So it takes the best parts of those worlds, puts it into one simple item, and it can get wet, and you can machine wash it, and you can reuse it. You can use your lint roller to clean it. It just becomes so versatile for the patient, and it allows you to no longer have the cast change and discard. You just simply have the cast check, and you machine wash and you reuse. But it also becomes your Robert Jones bandage. So as we think about destabilizing our patient through an entire casting treatment, we begin with some version of a cast. We take the front shells off, and we end up with a splint. When we're done with that and we still need some compression, then we have a Robert Jones bandage. It's just one product, just one simple thing. And because it's not elastic, you can add as much or as little compression as you want. You don't have the problems of the roping and the banding that occurs with the vet wrap. Because it has body and thickness to it, as you spiral wrap from distal to proximal, your material stays in place, and it doesn't like to bunch down because it has that structure inherent into it. The last thing I'd like to talk about is a really unique thing that is made possible to the vet profession because of the wood cast material and the Unitex fabric. What we have here is a really strange looking contraption. This is a preformed template out of the Unitex fabric. And this is a product that we designed to solve a really difficult presentation with our animal population when they have digit problems, digital fractures, pad problems and sores, or even those warts and blisters and wounds on the plantar surface or palmar surface, front or back leg. So the paw section, if you start to look at the splinting, you'll see there's a resemblance. along that lower segment of the metacarpal phalangeal joints and digits, as well as the metatarsal phalangeal joints and digits. So it's the lower part. These are universal. They work for left or right, front or back. And it's a very innovative strapping system. So we strap around the base of the paw. So we include all the digits, and we wrap around underneath the base of the digits with a paw strap. So now we have all of the toes, all of the digits held within the fabric wrap. Next, we secure the patient into the little paw product here, and we actually wrap the metacarpal or metatarsal strap around their leg and around the little paw support. And what we're really excited to show you here is that once we have them secured in, these two tails that you have left, they're going to crisscross for the thoracic limb just above the styloids and the accessory carpal bone. So it almost looks like a sandal strapping. But what this does is it creates an anchor on the distal anabrachium, because you've wrapped this circumferentially just proximal to the styloids and the accessory carpal bone. So now you have the control and stabilization you wanted to the metacarpal phalangeal joints and those interdigital joints and phalanges. Same with metatarsal phalangeal joint. What you end up with is control and stabilization where you needed, but you didn't have to immobilize the carpus or, for the pelvic limb, the tarsus joint, just because you tried to keep your coaptation on from falling off. So this is really allowing you to treat digital pathology and trauma in a way that you haven't been able to. And what we really get excited when we think about rehabilitation in sports medicine and non-surgical orthopedic medicine, we get really excited because this allows you to treat distal limb pathology without causing inadvertent harm by immobilizing a healthy joint. So when we look at the whole set here of the TLC system and all of its related products, what you have here is a way to either immobilize an entire limb segment from proximal femur all the way down to the digits, proximal humerus all the way down to the digits. So it's that full cast system for pelvic and thoracic limbs. We have the splinting system for thoracic limb carpus and for pelvic limb tarsus. And lastly, and most excitingly, for the casting system is the Unitex material. And that allows you to do all of those things that you have been doing, including turning this into your Robert Jones bandage. And lastly, and what's really new for the vet world, is to be able to stabilize just the digits with a simple strapping system with the fabric made out of Unitex to control and stabilize for digits without having to immobilize a healthy joint. So UPETS as a whole system for you allows you, with just 6 sizes for the thoracic limb, 6 sizes for the pelvic limb, to adapt to any patient who walks in, from the toy breeds up to the giant breeds, to offer them a full limb cast, a splint, or a padded bandage in a simple to use, fast and easy application process. When you're wondering about which size do you need to select for a thoracic limb or a pelvic limb TLC product, whether that be the paw, the full limb, or just the splints, you only have one measurement to take. And that measurement for the thoracic limb is from the ulnar styloid down to the 5th metacarpal head. On the pelvic limb, that's from the lateral malleoli down to the 5th metatarsal head. Just that one length for pelvic and thoracic limb, and that'll guide you to which size you should be looking at for that patient. And by clinical experience, you're free to choose a little bit higher in the size range or a little bit smaller in the size range. But that's the one measurement that you need to go to your shelf so you can see which one of these would fit your patient. So we'll look forward to serving you. As you have any further questions, don't hesitate to contact us at upets.vet.